So one of the things I just want to share like a couple of thoughts before I start in there. So, we've been talking about the telehealth. So the one of the thing we like to think is the word telehealth, we should just get rid of the word tele in there. Because at the end of the day, everything we do, all the people at work, really is a concept is about how to a new delivery model for healthcare is about how to solve a lot of issues in healthcare. So the whole idea is by dropping the word tele from there, we could actually rethink the solution we're building in a more coherent way in there. I think that's actually a better path to have something massive. So at VSee, the way we've been thinking about the whole telehealth ideas, our roadmap is, so we consider all the things we've been building up to is maybe a version 0.1 of our system. And what that is, just basic functionalities about now you could do a video visits, chat, screen share, devices, all these things. Then our next milestone we consider is we want to turn VSee into the fastest and most flexible way to build your telehealth app. The whole idea is if you want to create an app, it's just this really fast way to do it. Then for version 1.1, our version is the most simplest way. For example, you have some hardware, you have some software, you could easily incorporate into the VSee or our clinic, then VSee become a mechanism for you to sell to a lot of our community in there. Again, just whole idea, just very easy to adding modules to create this more extensive solution. And then the next milestone we're aiming towards, the idea is adding chatbot, symptom checker, communities, these are peer-to-peer like support infrastructure, plus escalation into virtual front desk, as well as escalate into provider. So we see this is like also as the way you think about care, not just I do telemedicine point-wise in there, but how do you have a holistic way from getting these from AI agents all the way down to getting peer interaction, all the way into connect to a virtual front desk, of course, ultimately the provider. We think this model will allow the provider to be more efficient, able to, again, have the biggest impact in there. Then finally is, I think since a year ago, maybe the biggest realization we find is, again, across the board, telehealth adoption is very low in there. So the insight we have is we should really think about telehealth is really a marketing tool. So again, a lot of the feature we've been building is the idea, how do you think about VSee Clinic as this marketing tool? Then as you're engaging with your patients, you're interacting, for example, sending a note to their birthday and so on, all of a sudden, this is a very graceful way for people to get involved and jump into telehealth in there. And another thing we're pretty excited to share is you've probably seen a bunch of things, about this smart conduct. A lot of people ask me, what is this thing in there? So it's basically VSee's newest medical group they created. It's a companion company we created for VSee. So the whole idea is, the problem we want to solve is, we want to create the largest medical physician group in the US. Again, these are people that work just little gaps of their times. We want to bundle them together. So what I mean by that, we want to create the world's fastest and biggest fire station is, if you look across the US, if you imagine right now, there's a fire alarm, bunch of fire alarms being pulled. What I mean by fire alarm is could be a patient with some medical condition. So today often is the fire truck couldn't show up. For example, let's say a patient in a skilled nursing home, they have a wound that's not healing properly. They should be seen by a wound care specialist. Often there's not a wound care physician around. Again, you have example over and over again. So our model is by having a very massive pool of physicians using their gaps in their times in there, we could turn that into a massive labor pool, so we could actually, again, deliver that fire truck when the issue happens in there. And then we have a lot of ideas about using virtual assistant, helping things massively and many, many things, and including, for example, building the physician brand in there. So we encourage all of you, if you're interested for this market, you're going to see a lot of our basically investors, basically our new bosses, owners are in the audience in there. So the theme for our conference is, the way we think about it, if you take all the pieces, everything pulling together, all the things that we're building, all the things you guys are building, when we add it together is, if we were to, let's say, if we do a thought experiment, so if, let's say, Amazon or Facebook create a medical insurance, like what would it look like? Like how will Amazon think about this medical insurance in there? Like how do they think about delivery care in there? So again, we think that of course there's a bunch of challenges you have to overcome in there, of course, from payers. So I know a lot of people complains about the payers, but ultimately payers, they have a very complex task. Really, it's about managing these massively complex coordination and collaboration. So it's a massively complicated work. Then from the providers, about less paperwork and so on. Of course, patients, about cheaper and more choices. So we've been, again, working on this American Doc for the last couple of months. We actually think we're coming close to a blueprint of what an insurance model might look like. And we actually think we should be able to lower the cost for the employers and payer by as much as half in there without sacrificing any medical quality and still deliver amazing care. Again, this is taking a lot of these sort of concepts that I think a lot of time people have talked about. Again, now we're just putting them together into a coherent play. So for example, we think through a lot of these sort of back-end automation, we could actually, typical provider might spend much 30% of their time paperwork, talking with the insurance. We should be able to reduce that down to about less than 5%. I mean, now the provider could spend more time working with the patients and engage so on. And we have another concept is, one of the things that's very annoying to the patients, the concept of in-network, out-of-network for your providers in there. We actually have a concept to just eliminate that. So how by coupling appropriate business model on top of that. And another big concept, the concept of medical co-op. The whole idea is getting the consumers have a skin in the game in the cost. Again, we think there's a bunch of ideas in here that could actually dramatically lower the cost of insurance in there. Then another big idea is the concept of distributed hospital. So of course we know that as soon as the patient touches the hospital, it becomes very expensive. So we've been working with a lot of hospital partners to think about what would be the hospital look like if you can imagine your hospital is actually distributing everyone's home everywhere, but again use the same prior network takers. You have the continuous in there. Then the biggest idea we have how we do this is, the idea is we want to do lots of experiments in there. So for example, Shamas, the guy at Facebook, got credit for making Facebook to 1 billion users. So he was giving a talk recently. He said the single one thing he did right at Facebook was, the idea is, if you come to any of his meetings, you check your ego at the door. And you come in there, you have to be data-driven. I mean, in order to have data, you do lots of experiments. So we find in healthcare, right, everybody has great ideas in there. But in terms of the implementation, it often takes a long time to do this. So our idea is we think is through, even though it's in medical, there's a lot of things we could do where the idea is from idea to go live, you should be able to get down to about less than 21 days. Again, we did a bunch of thought experiments, all the different things we think, different experiments, we actually think this is actually achievable in this. Again, by doing lots of experiments, you could almost take that sort of Facebook-ish rapid experiment to release every single day and take that same concept, apply to healthcare, and this will allow us to discover, again, that not just have a great idea, but have the evidence to a tiny experiment to discover what that idea is and turn that into actually a working blueprint that works. And so the way we like to think about the conference is the ideas worth sharing. So one thing unique about our conference, we've been over the past couple of months working very closely with every single speaker. The whole idea is we want to have this where, like, it's not just a typical conference you come into. They have a typical the marketing-ish type of thing that approved by lawyer. We want to make this conference a little bit raw, right? It's about talking about failure sincerely, talk about the inside, and the central idea is have ideas that are worth sharing. And one of the theme is, what do you believe that the rest of the world doesn't believe in yet? In there, like what is that nugget of insight through your personal experience in there? So one thing we'll invite both all the speakers plus the audience member. If you have some insights, we'll have a recording room in there. So like for Sophia, will come to Brad. So we'd love to record you, give that answer on the video. So what we plan to do after the conference, we'll turn that into a video summary of everybody's, again, what is something that you believe the world doesn't believe in yet? Then we're going to publish this. Then for our conference, where the theme is, again, we're modeled after like the TED Talks in there. So the idea is just a fairly short presentation followed by a couple of questions. The whole idea, we want it to be a little more interactive in there.